Hello, my name is Marc Salvador. I'm working for Cooperativa Humanitaria. Today I will present you the module Alert Detection and Investigation. It's going to be a very practical presentation with several exercises. Let's go for it. So, first of all, the objective of the module will be that at the end of the module, the participants are able to detect signs of abnormality in a medical project, checking the medical and humanitarian indicators. So we want to explain how to classify information in time, place, person, how to interpret morbidity and mortality indicators. We will be able to detect humanitarian alerts promptly, how to do it, and we're going to define which are the main steps to follow, for example, an outbreak investigation, and the main lines of interventions to respond to an outbreak again. So first of all, we should define what's an alert. We can consider that an alert is an unusual pattern of a disease or a conditions. It's not only about diseases, it's about humanitarian situations also that can be warning the existence of an emergency. It should trigger an immediate investigation. What's surveillance? Another concept that we should clarify. Surveillance is a system collecting data that includes all the part of collection of the data, how we collect and how we classify the data, how we interpret. It's not only data, we need to interpret the data and to analyze it. We are not only collecting data, we try to analyze to find conclusions after this analysis. All these analyses can lead us to an action. If it's needed, after the collection, interpretation, and analysis, we can decide that an action is needed. That's why we are doing all the surveillance. So we're going to have normally in a project a surveillance system that can help us to early detect alerts. Sometimes we call this system early warning system that will warn us about alerts. These alerts will allow us to analyze further the situation and to declare promptly the emergency, to define that now it's an emergency and we should start a response. The response will include two lines of interventions. One is to reduce mortality and the other is to reduce morbidity. So reduce the number of people severely affected that could die on it, and also reduce the quantity of people infected by the disease, the morbidity. The surveillance system, as I said before, it's not only medical, it's part of medical and humanitarian also. We have the two sides. So on the medical side, we must check the medical events, conditions, diseases, and that can lead to a medical emergencies, like could be an outbreak or a nutritional crisis. On the humanitarian side, we're going to check contextual events and conditions, for example, security, one of them. So for socio-political economics and security context, demographic data, population movements, all this information must be checked in a regular basis in order to detect situations that are not normal and could be a humanitarian emergency. Kind of humanitarian emergencies: violence, population displacement due to different causes, natural disasters, conflicts. Okay, all these are different humanitarian situations that we should survey in terms in order to detect as soon as possible. In which situation it's important to reinforce our surveillance system? Quite a lot. Complex emergency, population displacement, overcrowding, poor living conditions. When we detect several or some of them, we should reinforce our surveillance system. Seasons and hazards like flooding, systems that get broken like water system or sanitation, low vaccination coverage, endemic areas, different things. Okay, on these cases, we reinforce our surveillance. Let's start now with some example of cases that we can collect, and we're going to explain with it all the indicators. So, for example, we have two populations, A and B. On A, we got 15 COVID cases, and in B, 10 COVID cases. Our question is, which is the situation that you consider the worst? And why? Can you answer the question, which is the place, A or B, that it's the worst? correct answer was we don't know still. We need more information. It's not enough only with number of cases. So let's imagine we add now more information. Why not having the population? Perhaps it can help us. Which is the worst situation now, A or B? What would you say? We have 20,000 people in A with 15 cases and 2,000 people in B. In total population in B, it's 2,000. Out of these 2,000, only 10 people had COVID. Which is the worst? Can you answer now? Good, you answered already. We can calculate one of the indicators now. We can consider an indicator calculating number of cases divided by the population. We see that in A, we have only 0.075% of population affected by the COVID. But in B, we have 0.5% of population affected. So it could be considered that B is worse than A. Let's see. And if we have more information, perhaps that would be the situation. We still not know, and we need more information to take the decision. So now we add this information. It's the graph of cases per week. Okay, we can see in A and B. Where is the worst situation? Can you answer now the question again? A or B? What do you consider? Good, you gave us an answer. Now that we see all this info, we could say that A is the worst situation because the outbreak in A is still ongoing. But in B, if we check, apparently it's over the outbreak. We had several cases in weeks 2, 3, 4, and 5, but now in week 6 and 7, we have no cases. Perhaps the outbreak is over. In A, instead, we still have cases, and every day we have more and more. So nowadays, I would be more worried about A situation. We have seen that then not only number of cases are needed. We need number of cases, we need population, and we need the time, the time frame of the cases. That's what we call that the information must be always organized in a table using place, time, person. The three components must be there. So for that we have this graph where, for example, we're going to have the place, the location A is the place, the person, time person we said, so person is number of cases, measles or COVID, and time it's the weeks, okay, the different weeks. So always we're going to organize the information this way, time, person. So for example, if we get reports of COVID cases in one area where we are intervening, we're going to try to understand what's the situation, and we're going to try to draw a graph that details place, time, person. How we collect the data? We can visit, for example, the health center. In the health center, we're going to find always a register book. This is an example of register book. You can see here with each line the different consultancies they have done and which is the diagnosis. So we can take the register book with the dates and we can try to draw a graph like this one here on the right. In this graph, we're going to see, as we said, the number of weeks, number of cases, and the different locations. So if you want, you can now try to take an Excel with this data that you can download on a PDF that will be attached and try to draw a graph of number of cases per week on Pesina, Ábalos, Samaniego, and La Bastida, the 4 villages you're going to find in the consultancy address. Try to do this, and after this slide I will show you which is the possible result that you should receive with the graph. You go for it with an Excel. Good. You create an Excel. Now the answer of this Excel should be something like this. This is the result you should receive. Take care to define which is the epidemiological week. We say 1, 2, 3, 4, 5. You should check with the Ministry of Health of the country you are working in, which is the epidemiological calendar they use to define which is week number 1 for them, or 2 or 3. Every country is defining which is the one, and sometimes are different. So that's important. So at the end, looking at this graph, we should be able to define which is the situation that is the worst for us. In this case, we could say, for example, some people may think that Pesina is the one that's worse. It's the one that's peaking highest. Is that correct? Are we missing something? If I add now another information like the population data, we're going to have denominators, number of people affected, as we saw before. That's important. So looking at how these graphs change, we have this with raw numbers of cases in different villages. This is the population in Avalos and in Pecina. So and if we divide number of cases by the population, this is the graph we receive. You see that it changed quite a lot. From this graph here, we get to this graph here. And here we thought that Pecina is the worst situation. Now, dividing by the population, what it's called an indicator called incidence, we see that the worst situation is in Avalos. Okay. So for the reason, the indicators will be so important. The indicators help us to put together not only raw numbers, but number of cases divided by population. That will help us to define where is the worst situation. So now I'm going to explain several indicators that will help us to analyze the different cases or situations we're going to face. Okay. The two first indicators I'm going to present are incidence and prevalence. Are very similar indicators, but with few differences. The incidence is are the new cases of a disease that occurs on a population at risk during a period of time. This concept of time is very important. So we calculate dividing the number of cases by the population during a period of time. Instead of that, the prevalence, it's measuring how many people it's affected in a given moment. Okay, it's like a picture. We calculate prevalence dividing all the pre-existing and existing cases of the disease during that moment. Okay. For example, if we see it in another way, sometimes it's easier to understand with water. No, the incidence would be the quantity of water getting into the reservoir, into the tank. Okay, finally we have a counter of water in the entrance of the house. This is the incidence. How many liters of water we consume by month, by week. Okay, that's what we pay finally. Yeah? Number of liters of water consumed by week. That's interesting, for example. Prevalence is how many liters of water we have in stock. So in case of a fire, we are more interested on prevalence. We need to know how many liters of water we have at home to extinguish the fire. In terms of paying the bill, the interest is the incidence during a period of 1 month, which is the consumption of water we had. Okay. So sometimes we say that the incidence is giving us a video. It gives us the progression, how the consumption is increasing or decreasing in the time, and the prevalence is the picture, how many cases we have. They have different uses. You're going to see that. So this is, for example, an example of a map where you can see the different prevalence of HIV in different countries. You can see here in the South Africa and the neighbor countries, they have a very high incidence that can go 25% of the population affected. This is total population, not total number of HIV cases divided by total population. Okay, and you see that Swaziland, Botswana, Lesotho, they have quite a very high prevalence. Then lower Uganda, or if you look at the map, different countries, different prevalence. That helps us to understand where are the cases concentrated, and we can focus our interventions looking at that. Okay. So let's have an exercise. We have the population in Avalos town, which are 18,000 people. 3,000 of them are under 5. During 1 week, we register 120 cases of measles, 100 of them under 5. Can you calculate the weekly incidence rate of the total population and for the kids under 5? Can you calculate that, please? Okay, you calculated the first indicator, the incidence of total population and under 5. These are the results. For the total population, we have 120 cases divided by the total population, which was 18,000, and multiplied by 1,000. So we're going to express on 6.7 per 1,000 per week. This 1,000 you can change. You can use 1,000, 100, 10,000, depends on the magnitude of the disease you are analyzing. If you are looking at HIV, sometimes in several countries it's percentage. If it's strange disease can be per 10,000. The only thing is that if you compare different villages or different contexts with the incidence, you must multiply always with the same factor. It's not fair to compare one place with 1,000 and the other with 100. But it's the same. For under 5 again, total cases 100, population 3,000, multiplied by 10,000, per 1,000, we have 33.3 per 1,000, per week. This will be the incidence. In Boccolmaio, second exercise, refugee camp in January 2005, there are 120 cases of tuberculosis on a population of 32,000 inhabitants. At the end of 2005, there are 144 cases of tuberculosis. There were no discharge and no deaths in the TB program, in the tuberculosis program. No population movements. So what's the prevalence of TB in January 2005? Can you calculate it? Good. So the result would be calculated like 120 cases divided by 32,000 of population. It's 0.375%. Second question, what's the prevalence of tuberculosis in December 2005? Can you calculate it? Great. So the result would be 144 cases, the number of cases in December 2005, 144, divided by 32,000, so 0.45% of population suffering of prevalence in December 2005. That's the picture in that particular moment. Okay, what's the incidence of tuberculosis along 2005? Now we ask for the incidence, not the prevalence. Can you calculate the incidence in 2005? Great. So to calculate the incidence, remember that it's the number of new cases during a period of time. So new cases in 2005 would be 144 at the end minus 120 that we had at the beginning. So in total, 24 new cases in 2005. So 24 divided by the total population, 32,000, it's 0.075% of incidence in this population. Another indicator would be, for example, attack rate. Attack rate can be called the cumulative incidence rate of a disease for a specific population or a period of time. It's calculated by the number of people at risk affected by the particular disease divided by the population. These are affected, not suffering of the disease at that particular moment, affected from the beginning of the outbreak. So the total number of cases that we had, for example, in COVID, the attack rate would be from the beginning of the outbreak in a particular country to the moment we are, how many cases we had of COVID that now are cured, suffering still, dead, wherever. Total number of cases divided by the total population at risk, so total population in this case. It measures the proportion of population affected. So it's a sign of magnitude of the disease. So an exercise, example of COVID in Avalos. We have 30,000 children under 5. These are the total number of cases per week. One is 100 cases, week 2, 120, week 3, 90, week 4, 60 cases. With that, you can calculate the weekly incidence rate, the weekly incidence rate. You can give us this figure. The cumulative cases, you can calculate also adding. And with these cumulative cases, you can calculate the attack rate. You can provide us the results with only one decimal, one decimal. For example, 10,1%. Okay, can you calculate this, please? Good. These are the results. If you calculate everything, it would be something like that. So 100 cases divided by the population, 3.3%. The last week, 60 cases, same population, 2%. But when we go to incidence, we must add all the cases. So the last week, we have 100 plus 120 plus 90 plus 60, 307 cases in total. And that's what we use for the attack rate. So 370 divided by 3,000 multiplied by 100, 12.3 3% of the population affected by COVID in this case, attack rate. You see the difference. Incidence is new cases, attack rate, total number of cases. Next indicator, case fatality rate, is the ratio or a proportion of people who died during a specific period of time, okay, about a disease. So number of deaths from a disease divided by the total population that suffered this disease at the same time, okay, measures the lethality of the disease, okay. So let's see some examples to understand better. Yellow fever in Kordofan, 2005. 602 new cases of yellow fever in 2 months. 439 were recovered and 163 died during the period of time. So remember that case fatality rate was total number of deaths divided by total number of cases at that period of time. Can you calculate now this case fatality rate in Kordofan? Great. So if you calculate correctly, it was 163 deaths over the 602 people affected in this period of time, 27% of case fatality rate. That tells you about severity, how many people it affects, the severity of the disease, how deadly is this disease for this population, and the case management even. No? We're going to have another example. So we have a cholera epidemic in Bissau, 2008. We have 2 villages, Bissau with 7,000 people living in there, and Tombali, 400 people. 230 deaths in Bissau, 25 in Tombali. So now you must decide where to go in a hospital. Which is the hospital you consider are managing better the cases? Would you go to Bissau if you are infected or you get it infected with cholera, or to Tombali? What do you consider is better? Can you calculate case fatality rate to understand which is the best case management? Great. If you did correctly, the calculation would be in Bissau 3.2% of case fatality rate, in Tombali 5.9%, meaning that Bissau, even though they have many more cases regarding the total number of cases, many more deaths regarding the total number of cases they treated, the case management was better. But in Tombali, few number of deaths, but the total population was low. So it's a higher case fatality rate, meaning worst case management, for example. Okay, you see that this indicator helps us to understand how is something like case management. Okay. 2 other indicators: crude mortality rate. It's the total number of deaths caused by a disease divided by the total population, multiplied by 10,000 and divided by number of days. Crude mortality rate, it's always expressed by 10,000. Okay, so we can compare different contexts, always 10,000. We have also under 5 crude mortality rate, which is the same but for kids under 5. So number of deaths under 5 divided by the population under 5, 10,000, and divided by number of days. It's all disease included here. Number of deaths of all the disease. It's not about one disease. Case fatality rate, it's one disease. Here it are all the disease included. Okay, let's see some examples. Refugee camp in South Sudan, 30,000 refugees are living in there. Among them, 6,000 are kids under 5. So in 2 weeks' time, 34 and 35, 14 days, there were 150 deaths registered. 65 were children under 5. Can you calculate crude mortality rate for the total population during these 14 days and under 5 mortality rate, please? Good. So if you calculate properly, crude mortality rate for the total would be 150 cases divided by the total population, 30,000, multiplied by 10,000. So that gives you 50 deaths per 10,000 per 14 days, 2 weeks, 14 days. But we said that we express by day. So we divide this 50 by 14. That says 3.6 deaths per 10,000 per day. Okay. Looking at the under 5 crude mortality rate, 65 divided by 6,000 multiplied by 10,000, it's 108 deaths per 14 days. Divided by 14, it gives you 7.7 deaths per 10,000 per day. Okay, much more higher crude mortality rate in between in the population under 5 in front of the total population, which is quite common under 5 are vulnerable, so are dying faster. So we said that we express always per 10,000 per day. Here you have a table that helps you to compare different situations, different crises, for example, Rwanda, or in Liberia, or Angola, and you see the crude mortality rate in these conflicts in 94 or in 2000s or wherever. So 34 in Rwanda, it's much higher than Angola in 2000. So this emergency was more severe than the one in Angola, even though both were quite big ones. Okay, that's a use of crude mortality rate, general mortality. We have tables that help us to understand which is the situation of the population depending on the crude mortality rate. So we say that if crude mortality rate is under 1 death per 10,000 per day, the situation is under control. If it's over, it's already emergency warning. If it's over 5, it's a major catastrophe. For kids under 5, we double these figures. 2 for situation under control, over 2 it's emergency, and major catastrophe will be 10. Okay, we double, because they are more vulnerable, they die faster. It's normal that the figures are bigger in this case. That helps us to say this context, it's an emergency because the mortality is 2 deaths every 10,000 per day. And that means that's an emergency. We should intervene. This indicator helps us to decide where to intervene. Okay. Nowadays, we can use these tables, which are standard for all the world, for developing countries. We can find particular tables for each country. You can ask to the Ministry of Health of the different countries, and they will provide with particular tables for each country. That's better to use these particular tables because it's more precise. The figure calculated for this particular country, it's more precise. Last indicator, proportional mortality. Proportional mortality, it's calculated by dividing the number of deaths due to a disease divided by the total number of deaths in a period of time. Okay, so we want to know which is the percentage of deaths due to measles in front of all the deaths. Okay, for example. So it gives you the main cause of mortality for population. Okay. So an exercise: 150 deaths in 3 months in a refugee camp. 70 were due to measles, which is the proportional mortality of measles. Can you calculate it, please? Good. So if you calculate properly, the result would be 70 divided by 150. It's 46% of deaths due to measles, which is huge. It's the half of the deaths were due to one disease, only one disease. The rest of the deaths, other diseases. We have seen these kind of situations also during COVID outbreaks, where we have a huge mortality increasing a lot, and due to COVID, it was the huge quantity of figure of deaths at the end. So that helps you to say, nowadays, in this case, measles is one of the main problems for this population. We should intervene on measles because it's causing a lot of deaths. Okay, the main killer, let's say, for this population in this camp. Okay, let's go to have all the indicators mixed now. Another exercise. So we have 3 months long cholera epidemic in a town. 2.3% of the population have been diagnosed with cholera. What indicator is this? What do you think? It's prevalence, incidence, attack rate? Can you select one? Okay, the correct answer was attack rate. It's an attack rate. It cannot be an incidence because it's a very long period of time, 3 months. Cholera, you're going to have in 3 months people who survived, people who died, and people who are infected still. So it's not, it's a very long period of time. It are all the cases from the beginning of the epidemic, what you are receiving here. It cannot be a prevalence because remember that a prevalence is a picture on a given moment. So number of cases in one day, in one moment. So it's an attack rate, total number of cases from the beginning to today, 2.3%. So another one, cholera epidemic in a town with 100,000 people, 1,000 cases and 50 deaths. What's the attack rate and the case fatality rate for this situation? So can you calculate? Okay, so the attack rate would be 1,000 people divided by the total population, 100,000. multiplied by 100, it's 1%, the attack rate. So it's the total number of people affected by the cholera divided by the total population. And in this case, we use 100. So 1% of the population were affected. Case fatality rate would be total number of deaths, 50, divided by total number of cases, not the population, only the cases, 1,000, multiplied by 100 in this case, 5% of deaths, okay? The last question, nutritional survey in a CAM, 12.4% of the population under 5 is found with SAM or MAM. SAM is severe acute malnutrition and MAM is moderate acute malnutrition. So they are diagnosed with malnutrition. Which kind of indicator is this? It's a prevalence, an incidence, or an attack rate? What do you think? Good. So the correct answer will be a prevalence. The SAM and MAM are prevalence. They are giving you the picture of the number of kids with severe acute malnutrition or moderate acute malnutrition. It's a prevalence, okay? So good. So now you can calculate here the case fatality rate. Can you do it? Calculate the case fatality rate and try to see if you can find information if it's a big or a low case fatality rate. Normally, each disease has its own case fatality rate. Let's check if cholera, the attack rate you receive, it's a high one or a low one. Can you go for it? Okay, the correct answer will be 4.3%. So 5 deaths over 150 cases, it's 4.3%. That's a very high case fatality rate. The target in a good intervention would be under 1% of case fatality rate. So why you consider, or which are the reasons you think that could bring this high case fatality rate? Can you think several reasons that could produce this high case fatality rate and the actions you would take? So for the reason we calculate indicators, not you to take actions. So now that we detected a high case fatality rate, why you think it's so high and which are the actions you would implement? Can you answer this, please? Okay, so the correct answer, or one possible answer, could be that the reasons why the case fatality rate is so high could be divided into case management. So the medical staff is not managing properly the cholera patients due to different questions, or the late arrival. Sometimes is accessibility the problem. So sometimes if they arrive too late, the medical department cannot save the life of this population. So let's look at possible activities we could do to improve our case management and our late arrival or accessibility. So for case management, we can improve our patient monitoring. So reinforce the training, adapt the staff, increasing the number of staff, increasing the people during the night shift sometimes. Define better the protocols, reinforce the kind trainings and protocols, the quantities of staff we said already. During the night, if you have a lot of deaths, you can improve the team or do a lot of checks to assure that everyone is doing properly during the night. Also, check the supply and drugs, that all the drugs are present in the correct place. These are some activities you could perform to improve the case management. For the late arrival, if the patients are arriving late to the health facility, what we can do is check security. If, for example, I don't know, if we should assure a referral system due to security incidents in the road, we can do this activity. If there is no option to move, perhaps we need to open another facility in another place of the city to reduce movements. Check the health-seeking behavior. Perhaps they are not trusting your system and they use another one. So you should improve this other system sometimes. Sensitization, in general, works to improve accessibility and decentralized treatment also. With the main lines are these. You see now that the analysis of one indicator can conduct us to activities to implement to improve the situation. This is the situation we are seeing now here. So a high case fatality rate must always follow by an investigation and after the investigation actions to decrease this case fatality rate. It's always linked, all this. We have seen the case of cholera, but all the disease, each disease has a different case fatality rate, but when it's high for the disease we are seeing, for example, Ebola, over 50%, probably it's too high. Even sometimes 50% is too high. So we should improve our treatment. Okay. So what should we do to intervene? No, so when we are having alarming reports beyond the emergency thresholds and support is requested, so we need to implement an immediate investigation to verify if the situation is an emergency or not. When we receive reports of situation out of control, we go for an investigation to understand what's going on in there. Okay. Potential alerts. An alarming situation must be followed always by investigation. We must have capacity to investigate all the alerts we are receiving in our teams. So let's go for another kind of exercise. Let's imagine you are in a regular project and these are your graphs. You are now in August and you receive all these graphs. Suddenly different diseases and different graphs. Can you check the situation on each graph and try to understand what do you think is going on there? Quite normally, nothing is going to be there. It's only a regular situation. We are not having outbreaks every day for all the diseases. It's only a regular situation. You should be able to detect these normal situations. You should be able to detect mistakes. Sometimes we have mistakes in the data, but you should also be able to detect when we have an emergency and launch the alert, the investigation. Good. So if we see the first graph, here you have, what do you think is going on in here? Okay, we see that the cases are on a line decreasing more or less. No, it's a low respiratory infection, and in July it's decreasing. Perhaps it's a seasonal pattern, no? And we are getting down. In the winter we have high number of cases, and in the summer lower. So it's normal, no emergency. It's a normal situation. This one, no, it's decreasing. This one, anemia. What do you think it's telling us? This graph. Can you say me? Okay, yeah, well, we realized that in April we have a peak of cases, a huge number of cases. Someone could think that we have an outbreak in April, but it's very strange. Only 1 month of outbreak? It's very strange. And in fact, we are late. We are in August now, so nothing to do. It's late. But let's imagine that another reason could be behind. Have you seen if we take out a zero, instead of considering 220 cases or something like that, we take out the last zero, we have 22 cases. Then the graph, it would be more constant, no? Like that, more or less, more normal. That's probably the reason. We have a mistyping. That happens. Sometimes we receive data with mistyping mistakes. So we should correct these as soon as we have them. It's too late in August. In April, we should detect already this, or in May. We cannot pass data like this. It's a mistake. This one, parasites, what do you think? Something is going on in here? What can you say? Okay, yeah, we don't have anything here. Right? It's a normal path, and we can see that it's increasing a little bit, but it's not a clear path. So it's a normal situation, and there is nothing to do. It's only a situation that we have, and we keep on going, and let's see if it increases later on. But for the moment, intestinal parasites are normal figures. And the last one, this one, we see that it's getting down, and suddenly in July it's picking up. What do you think? Okay, here, yeah, it's something different. Huh? The July cases are huge, the numbers we have, and we should check, for example, other data. No? For example, is July the season of malaria in the Castropulo project? If it's the season, perhaps it's normal. We should check data from other places to check if it's normal or not. But definitely we have a problem here. So why not having an investigation? Okay, we can start with data, and if the data confirms it, we should proceed with a complete investigation of the situation. Okay, so now we detected an alert. That's an alert. Okay, what we do after an alert, what do you propose? Which are the activities you propose to perform after this alert? Okay, some activities that we could do after this alert would be to check, for example, data of the last data we received, if it's a mistake or not. Perhaps it's a mistyping, as we have seen before. That could be a reason. Once we are sure it's not a mistake, these are real cases, we can compare with previous years. As I said, perhaps it's season, and it's normal, this figure. So it's not an emergency, it's just the seasonal path that every year we have. And then we don't need an alert investigation. We should report our line managers. We are increasing the number of malaria, so they are informed, and if they consider it's not normal, they could launch the intervention also, or the investigation better. And we should decide if we investigate or not, to define if it's an emergency or not. Okay. If you can start increasing the capacity of your project. It's obvious that you have more cases now than the month before, so you should perhaps think on increasing the capacity of human resources, rather than you may face an increase of case fatality rate due to malaria. Okay, when we have a peak, you must check the capacity you have and increase if needed in terms of human resources and supplies. But immediate investigation is important. As soon as we see a peak like this, if we consider it's a serious thing, it's not a mistake, we should launch an immediate investigation. Okay. Another thing we could do now in week 32, we are realizing about this situation. But if we analyze instead of by month, by week, this is the graph we have. Low cases in these weeks, but from week 26, 27, 28, 29, the graph is already increasing. So in weeks 26, 27, we should already be able to detect, oh, this is not normal, it's increasing quite a lot. We could start here the alert investigation. Now we are in week 32 in here. We are 1 month late. Okay, time is precious in emergencies and in outbreaks. So normally in outbreaks, epidemiological survey will be done weekly. Every week, we're going to check all the data to avoid arriving late to the emergencies. That's very important. Weekly surveillance is very important to intervene as soon as the outbreak is there or the emergency is there. Okay. So the alerts could be a cluster of deaths, health workers are getting sick, reports or rumors or epidemic diseases. These are alerts. All the alerts should be investigated, and the investigation will be can be an alert investigation, or in case of diseases, epidemic diseases, an outbreak investigation, normally conducted by people with experience with the disease. Every alert should be investigated, and with an outbreak investigation, we can investigate epidemics, and with alert investigation, normal situation in general, not epidemics. Okay. Okay, now I'm going to explain which are the main steps for an outbreak investigation. It doesn't depend, well, on the disease. These are the steps we more or less going to follow for all the diseases, outbreaks. Huh? So the first thing is to define the case. What does it mean, a case of cholera or a case of COVID? So for example, for cholera, do we need a rapid test to confirm the case, or only with diarrhea, watery diarrhea is enough? Normally that's the case, no? But we should agree on that. All the people working on the same outbreak, we should consider the same what's the case, rather than the data doesn't match. If for you the case needs fever and for me doesn't need fever in malaria or whatever, we cannot compare data. So we need to define first the case. Then we need to confirm the diagnosis. So if we have a cholera, we should send samples to a laboratory to confirm which is the kind of cholera we have. We have different kinds of cholera, so we should confirm which is the cholera we have. Then we should count cases and deaths. So create a list of a number of cases, and if they are dying, record this person died out of cholera at this date. So with this list, we will be able later on to create this graph of time, place, person that we have seen during the training. With all the information in the list, we can create this kind of graphs, time, place, person, that will help us to define where the situation is worse and where should we start intervening. Then we should be able to identify risk factors. So for cholera, for example, a risk factor will be bad water, hygiene, and sanitation conditions. A neighborhood with bad situation on that could be a focus of the outbreak. So we should identify the risk factors and the areas affected to be able to define where to start the intervention if needed. Then we need to analyze and prepare a report, putting all this info together that will help the people to get the info about the situation and to take decisions. Our line managers to receive this report will help to take the decisions and deploy the resources needed. And finally, we need to implement the measures of control of the epidemic and the prevention, these lines. No? In terms of measures, we're going to see that the objective of all the outbreaks, it's to respond to the outbreak. There are two lines. One is to reduce mortality, and a second is to reduce the spread of the disease. So to reduce mortality will be one of the lines of intervention, and the second line is to reduce the spread, the morbidity, how many people is affected of this disease. So the lines of intervention, the main lines of intervention for outbreaks will be always coordination with all the actors, surveillance, as we have seen, all the collection of data and analyze and interpret the data, case management to reduce the mortality, so proper case management for all the people affected, preventive activities to limit the spread of the disease, to reduce the spread, and community engagement and health promotion to inform the population what's going on and how can they help us to stop this outbreak. If you check, it's what we have seen on different outbreaks. For example, nowadays, everyone have seen probably the COVID emergency in his country. And one of the first things that we could detect is that all the different governments and organizations working in COVID, hospitals and other agencies, were getting coordinated to assure that all the people is working on the same line. That's one thing we have seen. Surveillance, they were working hard also defining which is a case and reporting all the data every day to understand where is the mortality, which is the neighborhood more affected, where should we intervene or not. Case management, we have seen that they were increasing the capacity of the hospitals, opening small hospitals here and there, improving the capacity of the different health facilities, small OPDs, and so to assure that they have capacity to treat easy COVID cases or to avoid the spread of disease in these areas. Preventive activities. We have seen a lot of preventive activities during COVID, like confinements or use of masks, hygiene, improving the hygiene everywhere, and community engagement. A lot of messages passed to the community to sensitize the population about what's going on and how can they help to stop this outbreak. Different messages for different people. Workers, one kind of message. Young people on discos or this kind of leisure activities. What should they take into consideration to avoid the spread of disease and so on. So we have seen all the different lines of activities during this COVID emergency. We have seen the same in cholera or measles. Sometimes for preventive activity in measles, we have vaccination, and it's a very good activity. In this case, for COVID, we still don't have, but we have others. Okay. Okay, and that's it. That's the end of the module of detecting and investigating alerts. Okay, thank you very much for your attention, and see you in the next module.